Hello and welcome to Dr. Alyssa's Hot Topics on Health. It's been a while since I've been on. I have had a third baby and that's kind of kept me away from the social media scene. But I am back. It's a new year and I want to help you reach those health goals and those milestones and those New Year's resolutions. So my question to you, when I'm talking to a patient about metabolism and health and maybe losing a little weight, the number one thing I like to focus on is, are you a fat burner or a sugar burner? Now, these are very simplified definitions of metabolism, but I want to talk to you about them because I think it explains a lot and makes a lot of sense. At least it did to me when I was learning about this. So if you are a sugar burner, you are depending on sugar in order to use energy. That means that when you run out, you feel hungry, or the word I like to use is hangry. It affects your emotions too. And a lot of times my sugar burners will get that 10 o'clock slump and then that 2 o'clock slump where they feel like they constantly need to eat to keep their energy levels up. And my sugar burners will wake up in the morning and feel starving. And their blood sugar will literally be going on a roller coaster up and down, depending on what they're eating and when they're eating. So if you're a sugar burner, this means that you are depending on food for your energy instantly. And what you don't use, you store as fat. So on the opposite end of that, my fat burners. So if you are a fat burner, you can go all day without eating and not even think twice about it. And I think my fat burners out there are like raising their hand. Yeah, totally, that's me. And my sugar burners are looking at them with green envy eyes, because I used to be one of those, and saying there is no way. There is no way I could go 8 hours without eating. I would die. And going from being a sugar burner to now a fat burner, and I've gone back and forth in between with 3 pregnancies, and even now I'm 4 months postpartum and still transitioning from sugar burning to fat burning, because this is not safe to do if you're pregnant or nursing. But I really want to educate you on the difference, because this can really impact your health. As a sugar burner, you are more likely to get diabetes, you are more likely to get heart disease, and you are more likely to have a stroke. And I don't know the numbers off the top of my head, but they are substantially increased with sugar burning. As a fat burner, you actually burn fat for energy. So when you run out of stores of what you're eating, you will tap into your fat cells and burn those for energy instead of depending on the food that you're eating. So when you're sitting there doing nothing, you're burning more fat than the average sugar burner. If you need help understanding how to get from sugar burning to fat burning, we can help. I love this because I've done it, and I have done it 3 times over during and after my pregnancies. So I've really honed in on what it takes food-wise and timing-wise. And again, this is going to be different for each individual. And that's why I like to work with people on an individual basis. So the program that we have at Roots Holistic Health is called Shape Reclaimed. And this is a nutritional program. It's inflammatory based, so it's anti-inflammatory. It's going to focus on decreasing your inflammation through the food you eat and when you eat it. Now, again, this is going to be different for everyone on an individual basis, but I'm talking about it because I know it can help. It has helped me, and it has helped a countless number of my patients get to their healthcare goals by decreasing weight, decreasing inflammation, and decreasing that constant need to eat by getting from sugar burning into fat burning. Keyword here is ketogenesis, and I know you guys have heard about the trendy word keto. It's great, but I think there can be some downfalls too. So if you are interested in learning more and getting back to where you need to be health-wise, please call us and we can help. We'll set up an initial consult to get to know you a little better and figure out what you need to reach your healthcare goals. The number here is 715-258-7001, and I will put other ways to reach us in the comments below. I hope you guys have a great 2020, and I look forward to seeing and hearing from you soon.